Good morning, Chair Hernandez and the rest of the committee. My name is Shellie Hayes-McMahon. I'm Executive Director of Planned Parenthood Texas Votes, and I am here to speak in opposition to HB 7, another piece of legislation aimed at further restricting access to medical protocol that has been proven safe and effective and used with a 97.4% success rate by over 4 million women, trans, and non-binary people since the year 2000, according to the FDA. And I'd like to point out that at no point in any pregnancy is anyone on the dais more qualified to make decisions about our health and access to care than a patient and their health provider. I am disappointed, again, that this body is seeking to legislate personal religious preferences and beliefs into law, playing politics with Texans' lives, wasting time on redundant and unnecessary legislation, and then also proposing financial gain for inserting yourselves into what is a personal and private matter. And while this bill may pass over the objections of thousands of Texans, I would challenge you as a body to use the morality you claim guides you in restricting the freedoms of Texans to make their own medical decisions about their bodies and point that compass towards what our communities really need. First, being a robust healthcare safety net, including the comprehensive sexual and reproductive health care provided by Planned Parenthood in Texas and across the country. I'd like to see you lower the rates of uninsured Texans. Texas is ranked first nationally, having the highest percentage of uninsured residents. Between 21.6 and 21.7% of Texans are uninsured. I would love to see some work on reducing the rates of maternal and infant mortality as Texas continues to possess an increasing rate of maternal mortality. Between 2019 and 2022, our maternal mortality rate rose by 56% compared to 11% nationwide. Texans.
Thank you very much. Any questions? Steve?
I'd like to ask you a question, please.
Yes, ma'am.
I noticed you dwelt a little bit on insurance coverage, lack of insurance coverage. And you may have heard some of the testimony earlier prior to your testifying that there had been some disparity studies, and in that data, it shows that there was a lack of persons who may have been pregnant who did not access a prenatal care. Did you hear that?
Yes, ma'am, I did.
Okay. And do you all encounter? Do you have any idea whether or not that? Do you all encounter any of those persons in your line of work?
Well, I work on the political side of Planned Parenthood. I can't speak as a Planned Parenthood healthcare provider. I do know that Planned Parenthood was kicked out of the Medicaid and Healthy Women's system quite a few years ago. So many of our patients are either self-funded, are using their own insurance, but the lack of access to Medicaid has definitely increased the lack of women being able to access reproductive health care as well as access birth control.
Thank you.